Good morning, everyone, and thank you for joining us. I'm Barb Collins, and I'm the CEO of Humber River Health. I've also been a nurse for 48 years, so it gives me great pleasure to welcome everyone this morning and to say Happy Nurses Week to all of you. Before we begin our event, I want to take a moment to acknowledge that the land we are standing on is part of Treaty 13. It is the territory of the Mississaugas of the Credit First Nations and the traditional territory of the Wendat and the Haudenosaunee Territory. Today, this meeting place is still home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work on this land. In the true spirit of truth and reconciliation, we at Humber River Health strive to improve the health and wellness of all the peoples on the land we serve. We pledge to provide exceptional care and deliver healthier communities through our values of compassion, professionalism, and respect. The purpose of Nursing Week is to celebrate all nurses and their profession. Nurses represent the largest group of health professionals in the system. They work in many roles and sectors, including public health, primary care, in hospitals, home care, long-term care, in addition to clinical practice. Nurses work in administration, education, research, and policy. They are key to the health of individuals and communities, and this is why I'm so pleased to be here today, to thank nurses and to mark the formal release in partnership with the Registered Nurses Association of Ontario, RNAO, of an evidence-based tool, a best practice guideline that will serve the interests of patients as we navigate the digital world in which we work and find ourselves. The BPG is called Clinical Practice in the Digital Health Environment. And what better place to hold this launch than in the command center of our hospital? This BPG was co-chaired by the late Dr. Vanessa Burkowski, who was the Chief Nursing Executive and Chief of People Strategy at Humber River Health. It was Vanessa who first identified a need for this kind of guideline. Vanessa co-chaired the expert panel with Maureen Chalabois, who is the Chief Nursing and Clinical Officer at Baycrest Healthcare. She's not able to be with us today because she is in Ottawa. But this guideline outlines recommendations for nurses and other health providers to advance and strengthen professional practice in a digital health environment. It will also improve health outcomes and equity for people receiving care across all settings and across our sectors. I'm pleased to introduce Doris Greenspun, who is the CEO of RNAO and who will tell us more about Vanessa and the visionary behind this guideline and the legacy she has left. Welcome, Doris.
Thank you so much. I said when I walked in that, number one, I came with running shoes. Not because that's what I do always, but just in honor of Vanessa. Number two, I was going to bring the nursing doll she gave me, but that would have made me cry in a day that she would have told me it's time to celebrate. So instead, let me talk a bit about Vanessa, a friend, a colleague, a leader in nursing, a leader in humanity, in fact. So Vanessa and I met about 3 days after she took the position of Chief Nurse Officer of this province. And she says, whether it was the case or was politics, that I was the first person she met. But we were joined by the hip from that moment until she left this place. She's watching today, and she is saying, it's time to be happy, it's time to celebrate. Vanessa was not really a person that was very fan of technology many, many years ago. In fact, she knew very little, but that shows the greatness of a leader, right? That she learned, she mastered it, and not only that, she became a visionary. In doing so, she was the editor of one of the issues of the Nursing Leadership Journal, a special issue on nursing in a digital hospital, speaking much about the work of the command center. And in fact, she also was the visionary that decided on the nursing tiles here that speak about the BPGs and alert colleagues that are here alerting in the units about any risks that may come as a result of potential falls, pressure injuries, etc. Vanessa then one day called me and said, I think we really have a problem that we need to solve together. And she spoke with me about the VPG on clinical practice in a digital health environment and the views of what she thought it should be about. I hope, Madam Dr. Vanessa, that we did justice. She was with us almost till the end of it. And Maureen Charlebois, another amazing colleague of mine and leader in nursing, shepherded the last few months of the VPG. Last nursing week, so I don't know if you know this, some of you I know, but Vanessa used to send Happy Nursing Week messages either to some of us, and either she will send or I will send. And that May 12th, a few years ago, she didn't send a message, and a few days after I thought something is wrong in the picture. And I sent her a Nursing Week message, and she said to me, I can't speak right now. I will call you in a few days. That was the beginning of a journey of courage, integrity, and tremendous, tremendous wisdom. Vanessa is a person that had the wisdom till the last moment of her life. It's not about intelligence only. It's about knowing how to live life. It's about knowing how to respect others. It's about being authentic to who you are and being authentic to what you believe in. And that was my friend Vanessa. I thought if to invite Norm, with whom I spoke yesterday, today, and then I thought that will be overstepping myself, and if Humber thought that he should be here, he would. But I think it would have been very difficult for him to be here today. Just last week, we recognized two amazing, amazing fellows of the Vanessa Burkowski Fellowship that we are doing jointly with RNFU. And I hope that you all will be able to contribute in honor of Vanessa, not because we need the funds, there is plenty of funds there, but because it's important to keep a person like Vanessa Burkowski, like Dr. Vanessa Burkowski, Order of Ontario, in mind all the time. And on that Order of Ontario was one of my greatest honor, not only to nominate her, but actually to speak with the Lieutenant General to make sure that it was done before she passed away. And she's one of the very few people that actually received the award in her home, in the company of her family. So to Vanessa, thank you for the VPG that we are launching today. I know that she would be very proud. And to all of you, thank you for hearing once again different sides of Vanessa, because many of you knew her well. Thank you to Humber River and to especially Barb Collins for agreeing to fund half of that VPG, because your finance director is here, and she said, but I'm not a nurse. I said, yes, but you are the most important person in this room, because she helped us fund half of the VPG, and again, not because we needed the funding, but because the VPG was out of order. Not because we knew that Vanessa was ill. When she conceptualized that, we didn't know, but because you, Barb, thought that it was important enough to take part on it. So thank you, all of you, for being today, and I'm going to introduce a top leader. That program at RNAO, the Best Practice Guidelines program, not only has produced 54 BPGs, that department, not just by number, because even if you weight by FTEs, they produce babies more than any other department at RNAO, no doubt, right, Marianne? Hands down. And I will introduce you to Christine Buchanan, who was the lead chair for the VPG, the lead staff for the VPG, working with Vanessa, Dr. Vanessa Burkowski, and working with Maureen Charlebois, and also working with Lorraine Bailey. Here you go, do hi, who is the second staff that learned under the wings of Christine, and now is running her own show as the first lead in other guidelines. Thank you, colleagues, please.
Thanks so much, Doris. Welcome, everyone, and happy Nursing Week. So I am very pleased to introduce this novel best practice guideline, which is a comprehensive document that provides guidance and resources for evidence-based practice. It's not intended to be a manual or a how-to guide, but rather a tool to guide best practices and evidence decision-making for nurses, the interprofessional team, educators, health service organizations, academic institutions, and persons and families receiving care. Upon completing extensive pre-development work to scope the literature, it was determined that there were no other existing guidelines focused specifically on guidance for nurses and health providers working in digital health environments. And when discussing this issue further with nurses and interprofessional team members in a variety of settings and sectors, including clinical care, administration, education, research, and policy, a true need for this guideline was further identified. So in June of 2021, RNAO convened an expert panel to start the development of this BPG and determine the purpose and scope. And as you heard, this panel was led by the visionary Dr. Vanessa Burkowski, as well as her partner, co-chair, Maureen Charlebois, the Chief Nursing and Clinical Officer at Bayshore Healthcare. The panel also included persons with lived experience and was interprofessional in composition, composed of individuals with knowledge and experience in clinical practice, education, research, and policy across a range of health service organizations, academic institutions, practice areas, and sectors where digital health technologies are used. These experts shared their insights on collaborative nursing practice in digital health environments when working with persons and families receiving care. The expert panel determined the purpose of this best practice guideline to be to foster nurses' ability to maintain, advance, and strengthen professional practice in the context of digital health environments. These include any settings where health providers, informatics professionals, administrators, managers, and persons or families receiving care work in supportive teams to leverage digital tools, technologies, and services in order to really optimize care delivery. Broadly, the guideline covers the skills and competencies required by frontline clinical nurses to ensure safe, quality, person-centered, and compassionate care through therapeutic relationships in digital health environments. It also discusses how nurses can become involved in the design, development, and evaluation of these technologies in these types of environments, and the skills and competencies required by nurse leaders and other leaders in all domains of clinical care, administration, education, research, and policy to really support the intersection between clinical practice and technology. And finally, it also discusses the organizational policies and procedures required to support and enable nurses within health systems to effectively influence, implement, and utilize digital health technologies. The guideline contains 6 good practice statements and 4 recommendations that fall into 3 broad categories of practice, education, organization, and policy. And the guideline was developed using the grading of recommendations, assessment, development, and evaluation, otherwise known as GRADE methodology, in order to support the rigorous guideline development process, which is in line with international guideline standards. The BPG contains a variety of supporting resources and appendices, including practical tools for nurses and health providers to use when caring for persons and families. In conclusion, digital health technologies are really being increasingly embedded into all aspects of our life, including within the healthcare sector. And these technologies introduce novel opportunities to address health system challenges and have the potential to enhance the quality of health practices and services across different sectors and settings. There was really a need for up-to-date evidence to guide nursing practice regarding safe and effective use of digital health technologies in these clinical practice environments. And this BPG provides evidence-based recommendations for nurses, members of the interprofessional team, health service organizations, and health systems to support this collaboration with persons and families. The BPG was developed to offer recommendations that support care and ultimately improve health outcomes and health equity for persons and families in digital health environments. The guideline is now available for free to download at rnao.ca, and those of us in the room today can also scan the QR code on the banner here, and it'll take you directly to the website. We really encourage you to read the good practice statements and recommendations further, as well as check out the supporting resources and appendices to help aid implementation of this guideline in your setting. I will now pass it over to Jennifer Yoon, who is the Deputy Chief Nursing Executive, Vice President of Quality, Patient Safety, and Risk here at Humber River Health, and she was also one of our expert panel members, and she's going to tell us a bit more about implementation of this guideline and use some examples from right here at Humber River.
Thank you. Before I do that, if it's okay, I'm going to share a couple of very quick stories about Vanessa. Most of you did have a chance to meet Vanessa when she was still working here. But way back when we were implementing the 25 nurse practitioner-led clinics, I remember she was the provincial chief nursing officer at the time. And then I went into a panic. So I went to her office and I said, Vanessa. And she said, what, Jen? And I said, we have to have an EMR for the clinics. And you don't know anything about EMRs. And she said, oh God, I don't. But I do know Maureen Charlebois, who is the chief nursing officer at Canada Health Infoway. And so it is without surprise that Maureen is the co-chair of this best practice guideline. And they work together so well to actually set the structures and the processes for all the dialogues and fantastic discussions that we had. But the other thing that came about when Vanessa had first come to Humber, and she said to me, Jen, you're going to love it. And I said, what? Why? And she said, I think this is going to be like the kind of place that you're going to want to play in. And I didn't fully understand what she was talking about. But when she came here, she was blown away when she had done her interview with you, Barb, and she got a chance to walk around and see the staff working with the technology so seamlessly and still talking to patients and families. She was amazed, and she came back to me and she said, Jen, you're going to love working at Humber. So I said, okay. And so when I came, I had the same amazement, just like you do when you tour so many different organizations throughout the building. So one day, I went to Vanessa and I said to her, oh my God, there's a really important case we have to look into the EMR. And again, you still don't know anything about the EMR. And she said, that's okay, Jen, you look in the chart. So I said, okay. So I opened the chart and I started to click. It looked to her random thing. So she said, stop pressing random buttons. I said, it's not random. Eventually, I'm going to find the information I'm looking for. And she said, that's not how it works. EMRs don't work that way. You have to go to a folder. You have to press this folder. Then you pick this section. And so she was very, very strict and regimented in how she was looking for information. It was there or wasn't there. And I said to her, hang on a sec. I'm just going to click. And it gave her a heart attack. But eventually, we got to the screen where we had the information that we needed to look for. So she turned to me and she said, I don't really like the way you look for information. And I turned to her and I said, I don't really like the way you look for information. And then and we said, why don't we go ask Barb how to settle this? And so, but the thing that Vanessa actually took from that, she asked me, when were you born? So I said, I don't know, maybe I'm like the Generation X age. And she said, well, I'm a baby boomer. I said, right. Now, so that's the clash that we have. But she said to me, I don't really think either of us is wrong or either of us is right, but we're in this really interesting precipice of how clinicians are working or interacting with technology. We need to do something about this. And of course I said, okay. And she ran over to talk to you, Barb, and she said, would it be okay with you if we could show the world the interface between nursing practice, which is decades and years of experience and knowledge and development and exploration and inquiry, now marrying so well with technology, we really need to publish the stuff that happens here at Humber. And that's how this journal came about. And so that's how we wanted to show the world that you could take lessons from us and spread them all over. And one of the key things that Vanessa had impressed upon the leadership team that was leading some of this work here was that we really need to make sure that we took into account the best practice guidelines. And wherever we could embed it, we did, because we knew that best practice guidelines were going to give you the recipe for good practices, but the best possible patient outcomes. So I just wanted to share those two little pieces of history that they're not embedded within those guidelines that you'll see, but they have meaning, especially for me, but I wanted to share that with you during Nursing Week. Okay, back to the examples. So there are definitely several examples that we have actually embedded into this guideline. And the first one has to do with this practice statement. It is good practice that nurses and health providers be actively involved, engaged in the procurement, adoption, and implementation of digital health technologies when used in clinical practice. And so most of you will remember DocOpt. A large proportion of you in the audience here will remember it took us probably 3 to 4 years to scour through each and every possible best practice guideline that would be relevant to a particular area of practice or a particular service, and see how we could actually make sure that the questions that were being asked in our documentation matched the best practice guidelines, because we knew documentation was going to drive practice. And so that's something that, for those of you who were transitioning from the legacy sites to our new Humber site, that change in documentation has led us to some streamlined documentation, which is very nice. But the more important thing is that we wanted to make sure that you had the cues and the reminders for good practice. And for those of you who are brand new to Humber, just know that following the documentation, in case you forgot something, means that you're going to actually practice good clinical skills. The next recommendation I just want to highlight was the panel suggests that the health service organization implement interdisciplinary peer champion models to facilitate education for nurses and health providers on the use of digital health technologies. And so many of you will remember when you were transitioning from the legacy sites to this new site, how much orientation and education was dedicated to staff to make sure that they were going to not be thrown into a novel environment, but really be really equipped. And so there was a lot of support networks that I was able to see from all the records I had looked at to make sure that clinicians are in the best possible place to start working in this beautiful brand new environment. Many new things, features that were also embedded here. You have the closed loop medication system that's very admired worldwide and not so often spoken about, but even our violence prevention program, how it really uses the interoperability model of communication, and even Val here from our security services is here. Violence prevention is a major part, whether we want to recognize it or not, of healthy work environments for clinicians. And so that was a major component that's also embedded into daily work here at this hospital. Expert panel suggests that the health service organization implement clinical decision support systems and early warning systems that use artificial intelligence-driven predictive analytics to support nurses and healthcare providers in their clinical decision making. And so, of course, with Barb's keen eye, and she had made some keen observations throughout the world, and she came back to this organization and asked the leadership team, let's build a command center, second to none in the world. Not only looking at patient flow, but also looking at patient outcomes. What could we do to prevent risks wherever possible and keep a close eye on patients? And so we're in the beautiful command center, which is, again, admired internationally, and all the multitude of tiles behind us that really examine various areas of services and areas of practice. And most of you will know that the alerts that have been developed here are stratified, so that some of them are going to our staff, some of them will go to our patient expediters and the patient flow managers behind us. But there's always ways to access the information behind us, because this is the true plan for a stopgap on safety. So really, there are so many interesting, complex systems that have been designed behind the scenes, but really driven by clinicians, really driven by nursing leaders. And it's been a privilege to be here to share some examples and be a part of this work. So thank you. I'll hand it over to Barb in case there are any questions.
So thank you, Jen, and thank you to everybody for the work that was done on this. It isn't without notice that as we look at nursing and healthcare worker retention, and we particularly look at nursing retention, the Chief Nursing Officer of Canada, Lee Chapman, has produced, with lots of input from many people, a book that talks about different aspects of work life that would help us to retain nurses, and one component of that is about digital preparedness. It's about decreasing the amount of administrative burden there are on frontline nurses, but nurses everywhere. And so I do think this guideline is very timely, in fact, visionary, because I think when we first started this work, people were not talking about retention as much as they are now. So good that we got that developed early, and good that Humber did it, because we are North America's first first digital hospital. So important that we took a leadership role there, and I think that's why it was so important. Never mind Jen trying to figure out what Vanessa wanted anyway. But it did work out well for us, and I'm very pleased that this is going to be out there and will contribute to people's understanding of the importance of the digital, and particularly as we work through nursing retention issues, give us some guidance in that. So I thank everybody who has been involved. I think it's going to be a great opportunity to get that published and out there. We were going to open the floor to questions, and I have a few minutes if anyone has any questions or anything they want to ask. We'll just give you a minute. You're probably all going to be shy and quiet, right? All right, we're going to be here for a few minutes, so if people want to ask anything in particular, they can. There's a reception in room 3 and 4 across the way, and I see out of the corner of my eye that Doris is going to say something, so come on up.
I just want to acknowledge a few of our very important staff here that have helped not only this guideline, but 54 evidence-based guidelines at different stages. You guys didn't help all of them, but I saw all of them happening, and you are part of many of them. So first of all, Acting Associate Director Amy Bird, please say hi. I already acknowledged Lorraine Bailey, that was the co-lead staff with Christine. And I don't know if Susan is here, Susan McNeil. Hi, Susan. She is the Associate Director for Guideline Implementation, so we are doing a BPSO OHT, and Barb also had a big role on that, and I was privileged actually to be invited by the OHT back then for the ministry assessment. Yes. And it was beautiful, and you guys shone, and you continue to shine. And so Susan will be speaking this afternoon with the OHT people. And I think Marianne Zich, of course, Director of Communications, who has seen many of the guidelines come to be, because how many years you are with us? 18, and Susan is 12. And then Raul Pinto, my right hand to anything to do with logistics of Iberoamerica Consortium, which is, my gosh, over 500 BPSOs in Spain and all over Latin America. Just came back with, we just were in Chile and Colombia, I forget where, because we keep going. And who else from our staff is here? And Raul, of course, is the multimedia staff at RNAO. Who else we have here from the staff? And yes, and then many at home, of course, and the colleagues at Bayshore with whom we have been working for many years. They are also stellar BPSOs, and I hadn't seen some of you since before the damn pandemic, because there is no other word for that one.
That's exactly it.
Yes, so thank you. And to the colleagues of HRH, that's many of them I had seen before, our lead BPSO leader, right? Please, yes, thank you. And thank you for all of you. And I thought that this lady was from the board, and I had seen her last time, but I might be wrong. But is there anybody from the board of Amber?
No.
Okay, well, please tell them that you guys are amazing, because we think the world of you.
Thank you. We will do that.
Thank you.
There is a reception across the hall in 3 and 4 if you want to go over, or at least room 3, and then some people will come over there to chat about this as well. So thank you very much for joining us today. Doris, a lot of thanks to you and your team for being here.
I'm going to take this away.
Take that away. We're going to let you go first.
Doris.